There's Figgy. It's our Figgy update. We are heading to the vet. He is having a little bit harder time getting around, but he's still doing good. We added some Rimadyl to his what he's getting every day, but as you can see, he is very excited to go. So I kind of back this up so that it's not such a hard jump for him, but you'll watch. Come on, Figgy. He loves to ride. He's got his bully stick in there. He loves going places. He's got an oncology appointment today in Nashville. And he's been on Palladia for about a week now. He's been on it, along with a blood pressure medication. So no side effects that I can tell. He's doing good. So we will update after we get out of the oncologist. Aiden's coming along for the ride today because it's summertime, right?
Yeah.
And he doesn't have school. So we will give you Figgy. He says he's busy eating his bully stick. Give you an update later today. Figgy's waiting to see the doctor. I said to go boy. They'll come right out of there. They'll come get him. Then we'll have an update. There's Figgy loaded back up, and we are headed home. He is doing very good. I will maybe insert the audio from the vet if I can, but basically he's tolerating the chemo well at this point in time. His blood pressure was taken today, and it is normal. So the Palladia that he's on can increase the blood pressure. And the Losartan, which is the blood pressure medication that works alongside of it, that they're finding increases efficacy, that helps to lower the blood pressure. So great news. His blood pressure is perfect today. They said he's good to have the Rimadyl alongside the chemo every once in a while. So we'll put him on a low dose just to keep him comfortable on that back leg, because obviously being his size, arthritis and things are going to set in with only having that one rear leg. But they said he is in great spirits. And on the outside, so they can't really measure. You can see I actually had them shave this because I put castor oil on it. Castor oil is supposed to help with tumors, whether it does or not. They said it won't hurt. So I had them shave that so that I can get it down better into his skin. They'll come right out of there. They'll come get him. Then we'll have an update. But on the exterior is what they're measuring this at. So we really can't measure inside, but it does feel like if I grab it, it's like this big around now, which it used to be kind of like this. So it feels like it's getting bigger inside. But she also explained that it's also a fixing in there, but it's becoming kind of not quite such a round shape. But overall, we're really happy because the rate at which it was growing between his first and second visit since we noticed it was rapid, and it's kind of seemed to stabilize a little bit. So we don't have, she said it does take a little while for that Palladia to kick in, so we don't really have full efficacy yet, but we're doing good. He's tolerating it, and he is in great spirits. He gave everybody Figgy lovin's, didn't you? Everybody got Figgy lovin's. Yep. And they were all happy to see him and see him doing very well. So thank you all for your support, your love, your thoughts, your prayers, and all your well wishes. Figgy appreciates it, and so do we.
The Losartan is a blood pressure medication to bring it down, so that can cause low blood pressure. So Palladia can cause increase, Losartan can cause decrease.
Okay.
So there's multiple reasons why we're rechecking it, but the good news is totally normal.
Oh, perfect.
Yes. I measured the mass. It was 7 by 7 centimeters last time. I'm measuring it 7.2 by 7.7 today. I would say that's probably pretty stable because I wasn't the one who measured it last time, so there's always a little bit of variability. So in 2 weeks, it hasn't blown up.
Now, is that the mass in its entirety, or just what we're seeing on the outside?
Well, we definitely can't measure what's beneath it, but anything that's deeper, we obviously can't measure.
Because I feel like it's getting bigger underneath.
Before, we used to be able to grab it and kind of pick it up and move it around a little bit. And so if it is going deeper and delving, then you're going to have a harder time picking it up and moving it around because it's got more little tendrils that are holding on to things. But it doubled in size the first first time. I think that's a win because it's been 2 weeks and it hasn't blown up. But
And
again,
it's been like more than that since that initial, right? Since we
Yeah.
were going to go into surgery.
Exactly. And
Okay.
so the Palladia can take up to 4 weeks to really start working. The Losartan helps it like increase its efficacy and help try to bring down the disease. But you know, it's been only 2 weeks. So
Right.
stable disease is also a really good option if he's still healthy and doing well.
He-
No, I think he looks great.
Yeah.
And I'm so happy that this hasn't like, I didn't know what I was going to be coming into today because of how quickly it was going before. So
Right.
I'm tentatively happy with how
Right.
things look today. So what I'd like to do is I'd like to see him back in 2 weeks. And
Okay.
At that time, we'll recheck blood work and just make sure that the Losartan isn't too hard on the kidneys. We'll make sure that the Palladia isn't causing him any decreased white blood cells or platelets. Make sure that it's safe to continue.
Okay.
And then up to you, since it will have been 4 weeks at that time that he's been on the Palladia, we could recheck chest x-rays at that time, or we can give him a little bit more time.
I think recheck just so we know where we're at, and
If we know that he's been getting it for a full month, then you know at least making sure that things are stable when we would expect it to be, effective. I think is a good plan.
he had mentioned that this is kind of a new thing, so I
Yes.
feel like if we have a chance to document some more cases, better for everybody.
I've seen really good results with this. I've been pleasantly surprised only because we really didn't have any other options for dogs that got to this point.
Right.
Appreciate you being very open. I know this was not how we planned.
Yeah, no, he was great though. He answered all my questions because I ask a lot.
Yeah, it's okay. It's okay.
I want to be able to fully understand what we're doing. I did tell him I noticed a few days he kind of was having a little more difficulty upon like after rest, getting up, kind of moving around. There was a
we need
day
more ibuprofen.
I had to help him up the stairs.
Okay.
So I kind of added that. The first day I gave him 2 doses,
Okay.
and then I've just been doing 1 dose a day.
Okay.
So I don't know.
For the carprofen?
Right.
Okay. I mean, he can get it twice a day more consistently.
Okay.
Because we just know that without that leg, I mean, he wasn't really using that leg for a while before we removed it too.
Right.
So we know that if we're going to be off, it's going to push all the workload onto the other limbs, and it can progress arthritis and changes more quickly than it would if he had all 4.
Mm-hmm.
So we give Palladia, Losartan, carprofen all the time, and dogs do very, very well. But if for some reason we give all of those and you start seeing some GI upset, then the carprofen might be the one thing that we give him a break from to make sure that it's not the Palladia,
Okay.
and then we try to troubleshoot it. But most dogs do great on all the medications together. It's not contraindicated to give both together.
And can I kind of give that as needed, or do you feel like it really needs to build up in the system?
You know, a lot of people think different things. So, it's essentially, we consider it like a doggy ibuprofen, which a lot of people just take when they need it.
Right.
But when you have advanced orthopedic disease, it's usually better to give it consistently so that you're not trying to give something to decrease pain when their pain level's already up to here.
Gotcha.
It's much easier for us to maintain a level of comfort than it is to overcome a lot of discomfort.
Not
what we
let
call
him-
wind-up pain, which is something where if he's really, really uncomfortable for some reason and we give something, it may not be as effective for him because there's just too much adrenaline and pain.
Gotcha. And he's so stoic anyway.
I don't know that he would tell you.
He does, and that's why I noticed he was stiff when he went outside, and there's 5 kind of real shallow stairs coming up to our porch, and he was just sitting at the bottom, like step, waiting for me.
I would consider giving it consistently, but then if you're concerned that he is having any GI upset, like decreased appetite, nausea, diarrhea, or anything like that, then you can decrease it to once a day or stop it and call us.
Mm-hmm.
And we can talk about how to troubleshoot between Palladia and the carprofen.
Okay.
But since he's been getting the Palladia, potentially a little bit more consistently than the carprofen, then and he's handling it well.
Yeah.
I would expect it to randomly start having a problem again. So I would expect that if he does have any signs, it would be because we're giving the carprofen more frequently.
Okay.
Otherwise, let's plan on seeing him back in 2 weeks.
Okay.